The medical system has been an absolute abomination at chronic conditions, which lead to over 80% of US deaths and lead to over 80% of US healthcare costs. That is the conditions like obesity, like depression, like infertility, like diabetes, like heart disease. Arguably the most respected nutrition researcher in the country. He has been paid by over a dozen food companies. I call them bribes. This is rampant. You can't make this up, but it literally said that Lucky Charms are healthier than beef and Honey Nut Cheerios are healthier than eggs. We are actually facing a crisis right now of life expectancy due to deadly diseases that for every person with those deadly chronic diseases, there's been decades of warning signs that are not called out by the medical system.
Calley, we're currently in the middle of a health crisis right now. When it comes to chronic disease, when it comes to obesity, people being overweight, all kinds of issues going on right now. And obviously this is a complex issue, a lot of different factors. But where I want to start off, in your mind, what is the biggest factor that we can begin with to start to build that inertia and correct things?
I think it's mindset, Jesse. What I've been really hitting on is, I think there's a lot of forces that are blaming patients and blaming Americans for being unhealthy. When my sister went to medical school at Stanford, she was instructed almost daily that the American patient is going to be sedentary, is going to eat their Big Macs and want their big gulps, and is just predetermined to be lazy. And I think this mindset's really seeped into the American consciousness, that it's just kind of inevitable that we're going to make mistakes. And I think the mindset shift that I'm really putting together from my experience working for the food and pharmaceutical industries, and I think people are starting to wake up to, is this has actually been done to us. The largest industries in the country right now, food and the healthcare industry, the two largest, make more money when we're addicted, when we're in fear, when we're sick, when we're depressed. And I think that's important to actually understand. It's not to give us a pass from personal responsibility, but we have had a systematic effort really since World War II, since the real growth of these industries and the solidification of power of these industries, to get us addicted, to keep us in fear, to tell us that we're not capable of understanding what's best for us, for telling us that the solution to our issues is, in a pill bottle, is in a medical intervention. And we have a situation right now where every institution that impacts our health makes more money when we're sicker, depressed, infertile, fatter, quite frankly, and loses money when we learn metabolically healthy habits. So I think that acknowledgement of the systemic forces, which is not always talked about, is in some ways necessary for an empowerment journey and giving patients their own confidence of, frankly, questioning their doctor, even their nutritionist, and the powers that be, the powers that we're supposed to trust. I think until we actually understand what incentives drive those institutions and have confidence to potentially go against some of their advice, that's a necessary step for empowerment.
Part of what I feel you're saying there when it comes to the mindset piece is what you explained there is this mentality, and I think you explained even in medical school, where we're almost giving up on the patient before we begin. And what you're talking about here is taking back the power, giving people hope, giving people the tools to actually get to the root of the problem before we need medicine to come in and give us a pill that we're going to be on for life, or do some of the more drastic things that aren't necessarily getting to the root of the problem.
Yeah, and this is tough because we all know doctors and people in the medical system, and they're individually good people. But, the core undeniable incentive, let's just take healthcare. It's the largest industry in the country. It's the most employed industry in the country. Amazingly, despite, again, being the largest industry in the country, it's the fastest growing industry of any major industry in the United States. So it's actually compounding at double the rate of GDP. It's this organism that's designed to grow, right? It's like These are some of the largest companies in the world. They have shareholders. They're reporting growth and earnings every quarter, and their stock goes up if they grow. And there's huge institutional pressure among every level of these institutions to grow. Even hospitals, which we say, oh, they're nonprofit. In many U.S. states, hospital systems, nonprofit hospital systems, are the largest employers in the state. Hospitals, 10% of GDP of the United States flows through hospitals, mostly nonprofit hospitals. These are massive entities that employ tens of millions of people and are designed to grow. So we just have to understand that. That's not conspiratorial. It's not imputing any one person. But these systems are large and they have huge pressures to grow. And the way medicine is set up today is, again, 95% of spending in medicine is on people who are already sick to manage conditions, mostly chronic conditions. So when you look at what's happening to kids with, 50% of teens being overweight or obese, 25% of teens having fatty liver disease, almost a third of teens having prediabetes, these unthinkable statistics, that's actually, if you're dispassionately analyzing the incentives of the medical system, that's perfect for them, right? They couldn't design a better system because those kids aren't going to die right away. But if you're a child with prediabetes, with obesity, with fatty liver disease, you're inevitably going to have other comorbidities, and you're going to be put into the system where you're not cured, right? So when you go into the medical system with any of these chronic conditions, everything I've just mentioned is totally reversible. I mean, you can absolutely transform your blood sugar levels with the dietary and exercise interventions immediately. Diabetes is not actually a meaningful number. Diabetes is an arbitrary number on your blood glucose spectrum. It has no medical meaning. The exact marker for when diabetes starts. So all these things can be reversed. But the second that kid goes into the system with prediabetes or diabetes, they're put on medications for life. They're not told it's reversible. So they're managing, some biomarkers while their core metabolic dysfunction continues, which breeds more comorbidities, which makes the system money. So, when you get to 50, 60 years old, the average American is on over 6 medications. There's 6 different comorbidities that they're managing chronically, which is generating a recurring revenue for the system. So this has created the largest and fastest growing industry in the country. But that's really the battle I'm on with my sister. We can talk about who comes from a medical background and left the system. But that's the key issue. Us being sick is very profitable. And the way to get out of that treadmill, that chronic disease management treadmill, is very simple. It's with the things you're talking about and espousing, with the guests you've had on who've been massive inspirations for me on metabolic health. You take all those points. I think it's very important to expound on them. They're relatively simple points about getting the basics right on eating, on sleep, on movement, on stress management. That should be the basis of health. These simple things that Robert Lustig talks about, that Mark Hyman talks about, but it's complicated. It's complicated in the siloed diseases. So to me, that is the most important issue in the country, is to move our paradigm of chronic condition management away from siloed toward a universal kind of root cause metabolic health. But that view really does threaten the medical system as it stands right now, which is why it's being obfuscated.
While you talk about the size of this medical system and the money involved, it gets me thinking about, people like me and you who are tuned into what's happening and want to make change, and people listening to the show. But to me, there's 2 different areas where we can look to make that change. We can go after the system and try and make change there, or we could go grassroots and spread information like we're doing and trying and empowering people so they can make changes within their lives and their families' lives. So when it comes to, we're going to, there's a long time we're going to be able to get into a lot of the nuance here, but how do you look at that? Where are people supposed to put their energy when it comes to making change?
Yeah, I feel a lot of gratitude because I get a lot of energy and life meaning out of attacking and talking about the top down. And I have been able to engage with members of Congress, the White House, and politicians from both sides of the aisle. And let me be clear, I do think there are top down issues. We have the largest industries in the United States fundamentally incentivized for us to be sicker, fatter, more depressed, and more infertile. That is a big dynamic. We are fighting with a hand tied behind our back for our health. And again, I don't want to. I do think this is the biggest issue in the world, and we should just use plain language. But one of the largest and most powerful industries in the country, that are the highest spenders on media advertising, that are the highest spenders on political donations, that are the highest spenders on lobbying, that are the highest donators to nutritional research, that are the highest funders of medical schools. When these industries fundamentally have incentives for us to be sick, that's a huge problem. So I do think top-down change is needed, and we can definitely go into that. But for an average person, for somebody listening, and I think everyone listening is on a journey of bottoms-up empowerment. And I think the two need to converge. And I actually think the bottoms-up empowerment will impact top-down change. I mean, at the end of the day, talking to members of Congress, it's like, how do you combat the money of pharma and the money of the healthcare and the money of big food? The only way to combat money is grassroots. So as people are waking up, and I think millions of moms are becoming increasingly frustrated walking into classrooms and seeing how many kids are metabolically unhealthy, how many kids are obese, how many kids have health problems, allergies, autoimmune conditions, fatty liver disease, things that we didn't used to see. I think that is happening from the bottoms up. I think people listening to your podcast, people listening to Joe Rogan, people listening to health podcasts, but literally you span from comedy podcasts to health podcasts to everything under the sun. We're all talking about the same issue of personal empowerment, metabolic health. It's the top books that are being sold, billions of people wearing biowearables to actually understand what's going on inside their body and not taking the system's word for it. So I think all of these things actually are relatively subversive and are coming together. But this is the journey I'm on. And, from my perspective as a former, early in my career lobbyist for the food and pharma industries, to me, what's been helpful for my journey and as a new parent is having the confidence actually, and I'll just say it very explicitly, to listen to your doctor, to take what they say into account. But the medical system, your pediatrician, your primary care provider, does not deserve the benefit of the doubt when it comes to preventing chronic conditions. Let me be very clear. When it comes to preventing chronic conditions, the medical system has been an absolute abomination at chronic conditions, which lead to over 80% of U.S. deaths and lead to over 80% of U.S. healthcare costs. That is the conditions like obesity, like depression, like infertility, like diabetes, like heart disease. These are the things that are torturing and shortening American life right now. And it's been a failure. If you have an acute issue, if you have a gunshot wound, if you have a burst of appendicitis, if you have a complicated childbirth, if you have an infection, the medical system is a miracle. You should absolutely listen to your doctor. But the from the personal empowerment, the bottoms up, I think what we're seeing is we actually have to trust ourselves a little bit more. And this is where, again, I think the books, the biowearables, the podcasts, people being on their own journey, I think is vital. And I think the top down and the bottoms up converge at some point. And that's my theory of change that I think will happen in the next 10 years.
I think a big part of this problem too is confusion, where even within the alternative quote unquote world, there are so many different mixed messages. And oftentimes that message is different than what you're going to get from your medical doctor. So what ends up happening, and again, this is an assumption, but I think it'd be a good thought exercise, is people are going to turn to the medical doctor as the professional and follow that guidance, which we're going to get into today. If you follow the dietary guidelines, you're in trouble when it comes to your metabolic health, which again is at the root of all this chronic disease. So if people are making an effort, they're likely to get discouraged because there's so much conflicting information, again, in the alternative health world. And then they go to their doctor and they're going to get a different message. There's so many different messages out there people probably don't know where to turn, and I don't blame them.
Yeah. So this is a very important dynamic around confusion. And let me be clear, the confusion is by design. So when I, again, about a decade plus ago, worked for the food industry, the stated goal around the conference table was seeding confusion among policymakers, doctors, and patients around nutritional guidance. So from public relations offices in Washington, D.C., there is hundreds of millions of dollars funneled to nutrition research. So food companies fund nutrition research at places like Harvard, Tufts, Stanford on down. Food companies fund that nutrition research at an 11 times higher rate than the NIH. So the lifeblood of nutrition research in the United States is from food companies. Arguably the most respected nutrition school in the country, Tufts Nutrition School, by many measures, more than 50% of their entire funding comes from processed food companies. So that's how it works. Okay, so sitting in the office there with food companies, why are they contributing hundreds of millions of dollars to research? Well, I can tell you that Coca-Cola and Kraft aren't interested in using their corporate money to advance unbiased scholarship. There wasn't a lust for producing and advancing blind scholarship on advancing nutrition research forward. No, these are public relations documents. And the express goal, and this was said verbatim and they're on the table, the express goal of funding so much nutrition research, it's not even for the results of the research, it's that there's so much nutrition research. So the fact that there has been 50,000 studies, there's been 50,000 peer-reviewed nutrition studies released in just the last 2 years. The fact that there's 50,000 is the point. Because that's where, no, it's saturated fat's the problem. No, it's sugar's the problem. No, this is the problem. That's all by design. And you can step back from it and make this very logical observation. Giraffes in the wild aren't obese. Zebras aren't obese. There's no wild animal that has systematic obesity, that has systematic diabetes, that has, by any study that's done, massive amounts of depression. A wolf in the wild has a 1 to 2% cancer rate, and by any measurement, almost a 0% depression rate. Dogs that are domesticated and eat processed food and have more kind of human-like habits of sedentary behavior, dogs have a over 50% cancer rate and over a 50% depression rate. So that's what's happening. Actually, the problem is the experts. They're literally the only animals that are systematically obese, diabetic, have heart issues. They're animals that listen to nutrition experts. But they're also the animals that the largest industries in the country are making money off of. So that's the key. You are trying to be confused. Humans are born with an innate understanding of what's right for them, like every other animal, and that's been taken away from us. And it's a medical problem. It's an economic problem because human capital is being destroyed right now in the country from metabolic conditions. I think it's almost a spiritual problem that our agency has been taken away from us, an agency that every other animal has and is very successful with utilizing.
Okay, let me make sure I understand this. So what you're saying is these big companies in food are doing a massive amount of research. And the idea is to have a massive amount of different studies out there saying all different things to confuse us. And it doesn't so much matter what the conclusions are. It's the fact that there's this massive studies and people are going to be confused. That is their goal.
The goal is confusion.
And are they all pooling their money together? Because you have big food and then you have these corporations underneath. Are the big corporations all pooling their money and working together to fund this research? Or are they doing it independently?
Oh, it's total collusion. So Coke, Pepsi, and all the other sugar drink makers fund most of their money through the American Beverage Association and other front groups. There's a big push more on the pharma side and actually food companies helping with this effort. But on right now, Ozempic is a hot topic. If you Google like Ozempic bill, federal funding, there's a massive bill that's being pushed to federally fund Ozempic. It's all these Orwellian sounding like front groups, like Americans for, support of obese people, or, obese acceptance society of America. It's just all of these different front groups that the drug companies and food companies, they all band together. So the big one for drinks, again, is the American Beverage Association. There's the American Confectioners Association. For pharma, it's just called pharma. So they're able to then contribute to those groups. And then that's who I work for. So I consulted for a while for the American Beverage Association. So that was Coke and Pepsi aligning together to both steer nutrition research dollars, public affairs campaigns around these groups. And then they also would donate. It's really a question of who do people trust? So they trust research papers. Okay, so let's fund research. That's a tried and true method. I mean, the food pyramid was based on Harvard research, which was funded by the American Sugar Council, which is a front group for sugar, paid Harvard millions of dollars, produced studies saying sugar doesn't cause obesity, led to the food pyramid, basically recommending more carbs and sugar, less fat. But the cigarette companies' tried and true playbook in the 60s and 70s had a lot of front groups to produce research to confuse the issue of that. I mean, it's actually the same public relations firms, the same lobbying firms, the same consulting firms that helped the tobacco company. And as tobacco went down in the 1980s, they just shifted to food. Actually, a lot of the executives, a lot of the scientists, a lot of the lobbyists, they just moved to food. But yeah, they band together. They fund institutions that people trust. So when you look at the biggest funders of research, of medical groups themselves, so the American Diabetes Association, the American Academy of Pediatrics, the lifeblood of those organizations, which are medical organizations which set standards of care for medicine. The largest funders of those organizations are by far pharma and then food. The American Diabetes Association, you couldn't even make this up, but it has accepted millions of dollars from Coke, which is diabetes water. And then something I've talked about before, but civil rights groups and other groups that now it's a bunch, a lot of gender groups and Me Too groups to say that it's sexist to not support a certain issue. These corporations are very good at taking advantage of culture war issues to basically make it either racist or sexist or fat phobic or what have you to criticize their product. So that's happening systematically. It's not that complicated. And I think it's important for people to understand that these institutions of trust are pretty rigged.
All right, there's a lot of moving pieces here. I want to stick with the research piece for now. And I want to understand the motivation behind these groups of big companies pooling their money, basically paying to have research done. And there's, again, all these massive studies creating confusion. Is the idea to create that confusion so people don't realize how unhealthy their product is and keep buying it?
So sitting around with food executives, it's not like they are like knowingly like talking about doing evil things, right? It's like, well, we're making cheap and plentiful calories and we're making delicious soda for people to enjoy. And we've got people trying to attack our workers at hard-earned, brand and company. So we need to fight and execute levers to make sure we can protect ourselves. That's kind of what the goal starts at. And then it gets pretty tactical. So there's just a number of professors that are just known as pay to play. And, as a junior employee at these firms, I would research, right? Professors who have taken money from corporations before, There's lists of people that are basically, you know what you're going to get. There's think tanks, which are, produce research that's pretty impactful sometimes, that are fully pay to play, on the left and the right. So these companies have lists, and then the meetings with the professors, it's not usually a total quid pro quo conversation, but it's implicit. It's like the lifeblood of their research is funding, and it's hanging this $2 million funding, and it's wink wink. It's like, oh God, people are blaming Coca-Cola for every ill under the sun, and that's just not right. And we're trying to get some research on sugar, which has been around for and it's like, it's a wink wink. But you create these relationships with professors and institutions, and those lists are updated. And if you're willing to pay to play, you continue to get money, not just research money. Also dangling there in those conversations is consulting money. So a lot of these professors are able to take consulting payments. So the former dean of Tufts Med School, a man named, first name Dariush, I won't try to pronounce his last name, but Dariush, arguably the most respected nutrition researcher in the country. And it's public record. He has been paid by over a dozen food companies, not research grants, direct, I call them bribes, direct consulting fees. And he releases studies from Tufts Nutrition School, this notorious food compass. You can't make this up, but it literally said that Lucky Charms are healthier than beef and Honey Nut Cheerios are healthier than eggs. So, I actually talked to him and I asked him about this, and he's like, how dare you say that the financial incentives impact my research? That's not possible. I'm like, well, have you accepted, tens of millions of research grants and looks like over $1 million of direct payments, as he's calling me from Davos, angry. And he said, yes, but that hasn't impacted my research. And I just think it's something for the American people to decide, right? It does, the fact that your research and your vacation homes and trips to Davos, the fact that they're funded by food companies, does that impact what you decide to research and what potentially your research findings are? This is rampant. The majority of NIH grants go to professors who have direct conflicts of interest. 8,000 recent grants by last count of an examination by ProPublica. There's no conflicts of interest rules really to speak of at universities or with NIH grant making for pharmaceutical research or nutrition. So this is the game. The goals are multifaceted. For nutrition, confusion itself is the goal, right? So you just got to ask, what do the lobbyists need to show school boards, to show lawmakers? If they've got a bunch of different studies confusing the situation, they can go in the office and be, oh, no, you can't stigmatize sugar. That's not clear. It's not clear that's the problem. Here you go. If you have a study saying Lucky Charms are healthier than eggs, you can go into school boards and say, oh, you don't need fresh food, you can do Lucky Charms. This is from the NIH and Tufts Nutrition School. Here you go. So it's how do you create basically PR documentation to then go to people with money, so lawmakers, school boards, consumers themselves, to generate an expected result. So yeah, it's confusion and studies that explicitly recommend the product for food companies. And then for pharmaceutical companies, right, it's a little bit more explicit. You can design a study to say whatever you want. I think a huge misnomer and a huge thing we need to correct in the United States is that when we see a peer-reviewed research study from Harvard, we just, oh, that's what the data says. That's not what the data says. That's what they organize the data to say. And the key part of scientific research is what question you choose to ask and how you structure that question, not the question itself. I think that's how pharma research works. Every university in the country is looking for a marginal way to palliatively treat cancer patients, not how to prevent cancer. they're looking how to manage diabetes, not how to stop diabetes. That's what it leads to on the pharma side.
If you're enjoying the episode, take a second and let me know by clicking like and subscribe below. Thank you so much. And now back to the episode. When you're talking about food, you touched on something I think it's important to highlight, the fact that when a university like Tufts makes a conclusion like Lucky Charms are better than beef, it doesn't just impact the public who might, read the New York Times article that features that. It's going to impact policy in the public, like how the school systems, what they bring into the schools, and you touched on this, or even the hospitals, the jails. Like this becomes the standard that we have to follow. So it's beyond what we can even control in our own homes.
Oh yeah. So this is where the top down, we can't totally wash our hands of that. There is some trust and deference that we should give to our institutions. And I'll give you an example of exactly how this works. So we all kind of, some of us on this metabolic health journey, there's this stereotype of like the kids' birthday parties and they're all being served sugar. And, I go to our child's daycare and, he's the weird kid who doesn't have any of the food that they serve because it's actually, I think, reprehensible. You go to any daycare in this country and they're serving sugar. The kids are frankly, like little meth addicts. Sugar impacts the brain the same way as an illicit drug. And you truly have, a true addiction crisis among most young children in this country. But the key there, Jesse, is this is actually following recommendations of our government. So the USDA today says that a 2-year-old can have 10% of their diet as added sugar. So how did that happen? How does the US government tell us that a 2-year-old advise that they have up to 10% of their diet added sugar, which is essentially like saying 10% of your diet should be heroin. You're actually, it's actually in the way that it's a misnomer to recommend a certain percentage of a highly addictive drug, which sugar is by any definition, a limit on it. But we won't even get into that. How does that happen? The USDA every 5 years creates the nutrition guidelines. There's hundreds of billions, I would argue trillions of implications, trillions of dollars of implications for those nutrition guidelines because they flow into every other standard and basically set the standard for what every school, what every hospital, what every jail, what every daycare uses. 95% of the people that made the 2020 nutrition guidelines have been directly paid by food and or pharmaceutical companies, Coca-Cola, Kraft. Today, recently checking the 2025 panel, you can't even make this up. More than a fourth of all the announced panel has been directly paid by Novo Nordisk, who's the maker of Ozempic. So more than a fourth of the physicians who are making our nutritional guidelines are on the payroll of an obesity drug maker, which that's a whole thing to dive into why that is. So they pay off the doctors. The doctors go on the USDA nutrition panel. None of these FDA, NIH, USDA panels are bureaucrats within the government. They're all outside experts. So they pay off the experts. And our government actually recommends. So the tragic thing there is that Americans actually listen to medical leaders. When we were told actually smoking was really bad, finally in the 1980s, and the Surgeon General was reporting there was a big push, smoking rates have plummeted. It's still a problem, but smoking rates have absolutely plummeted since there was clear communication with the doctor. If tomorrow, and they could do this, tomorrow the USDA said, we're not going to ban sugar, but sugar is leading to a metabolic health crisis among children with skyrocketing obesity and diabetes rates. And we as a government should absolutely not be recommending added sugar for kids. You're not going to be arrested if you give your kid that. But we as a government, the standard, the goal should be 0 for a 2-year-old. If the USDA said that tomorrow, every daycare, every hospital, every pediatric center in the country would abide by those guidelines. And it would actually become more of a social stigma, correctly, to be giving every kid in the world sugar all day. So like, that's how it all plays out. And I think you make a great point. It's actually less about the consumers. I think the consumer confusion is very important, but these documents are all to give to the decision makers. And I'll just give one more anecdote. It was just instructive. I met with 40 members of Congress in the past couple of months from both sides of the aisle. These aren't evil people. They all have kids. They are all concerned about what's happening with health. But they, almost to a person, level with me and said, health, I can't understand all this stuff. When somebody comes into my office with all these studies from Harvard, and I'm worried about the Israel issue, I'm worried about the war in Ukraine, I'm on the committee that oversees the environment, at some point they have to defer. So that's how it all works.
Not to mention malpractice. If say a doctor's tuning into this and does some research and realizes what a healthy diet is to promote metabolic health in a lifestyle, I would assume if they go into practice and start recommending that to patients and it's against the dietary guidelines or a dietitian, they could probably get themselves in trouble not following the higher ups.
This is instituted. So if you go against I talked about the medical organizations recently, right? If a pediatrician goes against the guidelines of the American Pediatric Association, their license could be under threat. I mean, these groups are not like recommendations; they're the standard of care. So the American Academy of Pediatrics, which has accepted millions of dollars from food companies, and 80% of their funding comes from pharmaceutical companies. They make pediatricians give a dietary advice to kids that the first thing a child should eat, the first food they should eat, is highly processed grains. They literally say that they should start with puffs. That's with the document that pediatricians are required. Now, I haven't seen the evolutionary biological imperative to eat processed puffs. And miss the fact that that's what we're evolutionarily made to eat. But that is what the American Academy of Pediatrics says. And if a doctor actually doesn't, if a doctor, for instance, told a child to just, eat some pieces of meat and chew on some vegetables, a big piece of broccoli, they would be under threat. My sister, Dr. Calley Means, who is an advocate on a lot of these issues and started a metabolic health company called Levels, talks about this a lot. But she was reprimanded at Stanford Hospital and during her residency for even mentioning dietary nutrition advice to patients. At one point, a attending surgeon said to her that you didn't go to medical school to give nutrition advice. You're not a nutritionist. Another doctor at one point said, quote, don't be a pussy. That soft stuff that doctors don't do. We cut people open. We prescribe pills. There's that's I think how how it works.
And I really feel for people. I think your sister may have been in this boat where they realized it early on in their career. And I guess this is a side point, but if a doctor realizes that before they've paid off all their debt they've accumulated to get all this knowledge and to be trained as a professional, they're kind of in a predicament. Not kind of, they are in a predicament where they have this debt and they've gotten this education, but then they learn that there's this whole other side and they're kind of stuck because they can't practice the way they want. And then the argument could be made even further to a doctor who's, say, paid off their debt, but it wouldn't be to the same extent. You see what I'm saying there? It's very tricky, especially for the new docs who are like tuning into the show and learning, and they're, say, $500,000 in debt, and they're like, okay, what do I do now?
I hear that 100%, and it's something that Casey, I'm helping her on her book, which will be released next year, and it's a huge point. Systemically, we have a very dysfunctional situation where the U.S. is a magnet for literally the best and brightest people in the world to come here and study medicine. So think about the system. It's exactly as you said. We then saddle those bright minds who are very idealistic. There's other ways they could make money for the amount they're going to work in medicine, right? It's not the most optimal way to make money. These are mission-based, very smart people going into U.S. medicine. We then saddle them with hundreds of thousands of dollars of debt and societal expectations and basically very targeted skills. They are saddled with that. They feel like they can't get out. And then you have the highest rate of suicide among any profession is doctors. You have the New York Times recently reporting that there is a epidemic level of depression among doctors, that the only analogy that they can find is soldiers who were forced by their superiors to commit war crimes. That is what's happening in the medical system. You have idealistic people, soldiers, doctors, coming into a system to do the right thing, and then realizing that the systematic confines of that system are actually pushing them to do things that are actually hurting the people that they got into this to serve. That's what's happening in every hospital in America. And I think every doctor, if they're honest, realizes that they might be prescribing a statin or helping on a procedure to help that patient in the moment, but systemically what they're doing is not helping the American patient. Again, missionaries who are working 100-hour weeks aren't committing suicide at epidemic levels or having epidemic levels of depression. The problem is I think with the issues you're seeing among doctors is that they know they're not helping. So I actually think the system I would describe at a high level as evil, in that it does this. It's wrong. And to those doctors listening, I mean, you've got to be on your own path. And obviously, this is a complicated issue, and there is a need to serve patients within the system. But I personally have been extremely proud of my sister because she had more than $500,000 go into this education. She had it was her entire identity. She did nothing other than work towards this goal, into her 30s. She abruptly quit. I thought she was crazy. I'm like, what are you doing? You've got all the credentials, like muscle through it. She's like, she didn't know what she was going to do. She just quit. And there's life on the other side. She started treating patients, giving them metabolic health advice one-on-one, which led to her having an insight on continuous glucose monitors, meeting some folks and starting out of those insights a company called Levels, which has issued continuous glucose monitors to hundreds of thousands of people, helping them understand their metabolic health, and really, I think, making a huge change in the world. So, that was just in a couple of years after leaving. And she said it was the best decision of her life, even though it was very scary. So I think there is a lot of room for doctors or people in the medical system to step outside of it to make an impact. But I think that is a huge dynamic, and I think it's very scary. So just wanted to share my sister's journey, and I hope that for anyone considering potentially another path, I think it is there because there's so much opportunity and so much frustration right now among the American patient to find answers. I mean, I'm not a doctor. I'm very passionate. I'm on my early stages of a journey for my health and my child's health, and have a company that's trying to change incentives. But the fact that people are DMing me asking for, very specific medical advice with huge frustration, that people I know who have the best medical care possible are reaching out to me with intense frustration. It's like, if they're reaching out to me, there's really a problem. I think there's really a hunger for sane medical advice and a market need for that.
And I think we're in a really unique time right now because of the internet in the last, say, 25 years, where doctors are able to turn on a podcast like this and the veil is lifted and hear the other side of the story, when before, all of us in different ways without the internet were fed information from the top down and just had to go with that and believe that. So it's unique in that people can learn the ulterior narrative due to the internet, creating situations like your sister.
Yeah, I think there's a battle right now where there's a immediate attack on patients doing their own research. There's just an immediate jumping on anyone for spouting medical misinformation, and this almost belittling of anyone trying to take their health into their own hands, right? This is enforced by two entities. It's enforced by the media and it's enforced by the government. The healthcare industry is the lifeblood of those two industries. So pharmaceutical companies, you can't even make this up, but by some measures account for over 50% of TV news ad spending. Working for pharmaceutical companies, we helped, steer money to pharma ads on TV. One just insight out of that, these goofy pharma ads you're seeing, a little bit of it is to impact consumers and get them to buy the latest drug. But the ad spending is really seen as a tool to influence the news itself. It's very known by the pharma companies that if they're the top spender on news ads, that then gives them implicit ability to steer the narrative of the news itself. And then with the government, the healthcare industry spends 5 times more than the oil industry on political donations and lobbying. It's by far the largest spender. It's the lifeblood of political donations and lobbying. So you have these two entities that fund. You have pharma that funds these two entities that then play referee and belittle anyone for asking their own questions. So an obvious example is COVID, which was a foodborne illness. You didn't die of COVID if you were metabolically healthy, which is clear. No matter what age you were, it was a disease that preyed on weak immune systems of metabolically unhealthy people. But to even say that, you would be castigated by both the government agencies and the news for being a science denier, for not completely submitting to the fact that this was just a pharmaceutical problem, that we didn't have a pharmaceutical drug. So that's what's happening time and time again. And the crazy thing to me is we don't point out, and if the media was, curious at all and unbiased at all, it'd be, does this system deserve any benefit of the doubt? And of course it doesn't. We're exponentially, healthcare is an industry where the more we spend, the worse outcomes get. So, that's what it buys. And I think, again, the point there for an individual person is there's a lot of incentives to convince you to scare you of taking your health into your own hands, or doing your own research on the internet. And I think it's awesome. I think it's, nobody can stop it of people listening to podcasts, of doing their own research, of reading the books. I think you have less to lose than you think, because the status quo is just not that great. I think you absolutely should be very skeptical. Again, when it comes to preventing chronic conditions, you should be skeptical when your doctor's pushing you to a statin. You should be skeptical when they're pushing SSRIs down your throat. You should be skeptical when they're pushing metformin down your throat. You should be asking what the root cause is. You should absolutely be skeptical when they're pushing your 12-year-old to take a shot for obesity for the rest of their lives, which is what the American Academy of Pediatrics is saying should be the first line of defense for the 50% of teenagers who are overweight or obese. Like, this is a dark path we're going down on, and you should be asking questions.
What's becoming very obvious is a big part of this problem is the dirty money, and the money being spent to, pay different medical establishments, and money being paid to people doing the research and universities. And how public is that? If people want to get to the root of where all this money is being spent and where funding is coming from, is this public knowledge, or is it something that you have to, hear from somebody that's on the inside?
So I'm just pulling this up here. It's the CMS site. There's a government site. I could send you the exact link. But you can search for any doctor and see their direct consulting payments. And I do that whenever I see a doctor on TV giving a pharmaceutical kind of pitch. I was recently watching 60 Minutes, and the head obesity doctor from Harvard was talking about how obesity is a genetic condition not tied to food or lifestyle, and that it's actually a brain disease that is not based on our personal decision making, and how it was an absolute imperative that we stop stigmatizing obesity as having anything to do with our personal decisions and must prescribe every child and adult who's overweight in the country Ozempic and have the government pay for it. After watching that segment on the most watched news program in the country, it ended and a pharma ad ran. So I learned that pharma is by far the largest funder of 60 Minutes. And then I researched that doctor on the database who in 2021, which is the last time we have data, this database has data, was paid $70,000 directly in bribes by Ozempic, which is public. And then it's harder, but the research grants should be disclosed, but actually that's voluntary. But you need there's different databases for that, but it's less. But yeah, they have to disclose the consulting payments. There's a way to check that. The lobbying has to be reported. So Open Secrets is a good resource for that. But you can watch what lobbying happens, and they have a graph of different industries. And as I said, if you add up all the healthcare interests, it's 5 times more than any other industry. But it's a lot of digging. I mean, yeah, like on that. Dr. Fatima Stanford at Harvard, I tweeted that out, and a lot of news organizations, actually independent news organizations, I'd say, not mainstream, who are funded by pharma, picked that up. But I think people are still learning how to do this. And, you kind of got to ask, right? It's like, is this outrage we're generating towards the system a good thing? I think the outrage cycles in America aren't always good, but I think this one is right. I think we should absolutely be very, whenever we see a doctor pushing us into a pharmaceutical path or not talking about root cause metabolic habits, I think it's simple. You said it, Jesse. It's like follow the money. I mean, I feel like sometimes I'm preaching very simple things, but these are tried and true. But yeah, we can put some in the show notes if you want. But there's a couple databases that I check regularly that when I'm thinking about someone with medical experts. And then, you got to follow the money with everyone. I have a company right now. It prescribes food and exercise. So we write doctor's notes and we make partnerships with like CrossFit and food companies to create medical plans. And if you have a medical plan, you can buy exercise and food tax-free. And we have relationships with brands like CrossFit where we get paid to issue these notes and drive hopefully more money to them by analyzing whether the patient could benefit from exercise and write those notes. Those are my financial interests. And people attack, yes, I'm trying to prescribe broccoli and I'm trying to prescribe CrossFit. I'm in the pocket of big broccoli. I'll admit that. And I hope we can prescribe a lot of broccoli and prescribe a lot of CrossFit to people that need it. I'm happy to have my financial interests. You have metabolic health leaders like Mark Hyman. I'm sure he'd be happy to talk about his financial interests. He's partnering with some supplement brands that are great and food companies and blood testing companies. It's like, I think everyone should have their financial incentives analyzed. I think it pretty much drives everything.
Earlier, when you talked about Ozempic, you said there was a further story on funding. Was that the doctor piece? The Harvard doctor?
So when I was just making the point that I searched that database and tweeted it out that she was funded $70,000, and then independent news outlets started reporting that. And I'm just saying, to me, the lesson there was most folks don't even know how to search these databases. And I think we still fall in the trap where it's just catnip when a doctor from Harvard goes on the news, it's taken as Bible, or when a study from Harvard comes out, it's just, this study is unimpeachable. And it's just like a mission of mine is to train people like we've got to follow the money. Even these large institutions and most respected institutions are pay-to-play organizations. The one other just point I'd make on Ozempic is obviously a doctor who's paid directly by the company and a news network that is paid directly by Ozempic, runs ads for Ozempic, running a news piece uncritically with no disclosing of conflicts, saying that obesity is a genetic condition, not tied to diet or exercise, is wrong. But the direct bribing that's happening there essentially isn't even the biggest financial conflict. The biggest financial conflict is that that doctor speaking runs an obesity clinic at Harvard. And if Ozempic is approved for government funding, that then gives her lifetime patients that are paid for by the government. If obesity, Ozempic becomes the standard of care for obesity, you have to take it for life. The weight comes back and you have horrible metabolic issues if you go off of it. So you have then a steady stream of patients for life that need that injection every week. So that's the biggest conflict, and that's the business model, right? So think about this. We've been convinced that obesity is an Ozempic deficiency, that heart disease is a statin deficiency, that depression is an SSRI deficiency, and that diabetes is a metformin deficiency. That's just a lie. I have a friend with Crohn's disease. The standard of care, what insurance will pay for, is that he needs to go into a hospital every single week and get injections, right? He did his own research on diet and literally said, I thank God for getting Crohn's disease because it led me on my own journey. I changed my diet and lifestyle around in 3 months. I have not been to a hospital in a long time, and I feel better and I'm healthier and solved the root causes than I ever have in my life. So this is the greatest thing that ever happened to me. But nobody's telling him from the medical system that he can change his life in 3 months. They're saying that he needs weekly injections. That is recurring revenue that makes people money. Every single condition that we have that's very quickly reversible can usually be dramatically improved very quickly with diet and lifestyle. It's so simple. I think COVID was a tragic case because I say this a lot, but like if all the medical leaders and the president, and frankly, the Secretary of the Treasury, because we're going bankrupt from chronic conditions, and the Secretary of Defense, because 80% of 21-year-olds aren't eligible to join the military because of their metabolic health and their fitness and their sedentary lifestyle. If we had a huge full court press to say we need to transform and strengthen the immune systems of our country, we need to get our food in line, we need to change healthcare policy to incentivizing more movement. We need to think about our urban design, how we increase movement like Europe. If we had a full court press, we could have transformed American health. We spent trillions and trillions of dollars on various COVID policies. We could have, for much cheaper, transformed, and that could have been done. A lot of people say, well, that's a long-term solve. No, like I've been on this journey. I mean, I've seen it myself. Just hitting the gym a little bit, working on your food, you can change your biomarkers in a matter of months, very quickly. Your metabolic biomarkers that dramatically then reduce your risks for other comorbidities. So, yeah, that's where I think it all connects together.
Up until this point, you've given us a good behind the scenes of all the different money being exchanged and the unethical practices. I'm curious now to go back to the beginning. How did all this start? How far back does it go? Like I'm picturing back in the 1950s, and you mentioned smoking before and the whole situation. And I think you use that as an analogy for what we're going through now and the topic we're discussing today. But when it comes to pharmaceuticals and food and this influence we're getting from the top down, when did that begin?
Yeah. Great question. So on the medical side, which set the tone for food, well, let me just start this way. The fundamental thesis is that there's a devil's bargain that's happened in the past 120 years where food is becoming cheaper and more addictive, making us sicker, which is in the food industry's interest. You'd expect the medical system to ring the alarm bells on that, but the medical system actually implicitly wants that because the food making us sicker, more depressed, more infertile, et cetera, makes the medical system money. So they've stood silent and profited and washed their hands of why people are getting sick. That's the devil's bargain. It started in 1909 when medicine was the Wild West. In 1909, the fourth most prescribed drug in the country was heroin. So heroin was a name and a brand of a drug patented by Bayer, the aspirin maker. And heroin was prescribed to nearly every baby in the country. So heroin, you can't make this up, but heroin was a patented trademark by Bayer for a drug for infants to cure finicky behavior. So every baby in 1900, when they were crying a little bit too much, their parents gave them a drop of heroin, which marketed on the bottle that was totally safe for babies. So we were kind of in the Wild West. And there was a lot of witch doctors and stuff like that. Rockefeller, John D. Rockefeller, started the modern pharmaceutical industry looking for uses of oil byproducts, and was the first big pharmaceutical baron. And he, in order to sell pharmaceuticals, funded modern medical education. So he was the big grantee to Johns Hopkins and other early medical schools, and sought to create a medical system of evidence-based medicine that essentially siloed diseases into different categories where doctors could either do surgeries or prescribe drugs. This was a radical concept at the time. At the time, actually, medicine was more holistic, and the predominant medical theory was actually holistic, or things being connected. He said that's totally wrong. We need to identify the condition and prescribe a drug for it. And he funded Johns Hopkins, which created the modern medical education system of residency, of the different silos of specialties that doctors go into. So that was John Rockefeller's brainchild as an express, not again, to help the American people be healthier. It was to sell pharmaceutical drugs. That framework then was written by his lawyer. His last name was Flexner, was an employee of Rockefeller's, who created and just basically gave Congress the Flexner Report in 1909, which established evidence-based medicine as the only type of medicine that the U.S. government would fund and propagate. So there was actually a big debate. Should it be holistic? Should it be... So that was created by him. Okay, so we get a little bit more of a structured medical system, but still, until World War II, every single pharmaceutical product was something that you took for a finite period of time. So, then we get into antibiotics, and all the pills are things, okay, you've got a condition, take this, you're cured, you're done. After World War II, when medical trust was at its height, because antibiotics were actually credited a lot with winning World War II, we had the birth control pill in the late 1950s. And that was the first chronic condition pharmaceutical product ever. So the birth control pill was the first pill in American history that somebody didn't stop taking. And what a lot of medical leaders saw is that's a good business model. And actually, the Sackler family, I believe his name is Mortimer Sackler, who was the grandfather of the folks that did the opioid stuff later on, a father and grandfather. He worked for Pfizer in the 1950s and 1960s, saw the birth control pill, and he started asking, how can we create more chronic issues? So his first big thing was Valium. And Valium in the 1960s into the 1970s became the most popular drug in the country. Over 30% of women in the late 1960s into the 1970s were on Valium. And they ran ads in Time and Life saying, if you're fed up with your husband, take a happy pill and you'll be fine. Like, it was very sexist advertising, really a strategy led by the Sacklers to get people hooked on Valium. And then it just started exploding. So the Sacklers, right, they actually ran the largest chain of medical journals. So they started this whole thing where they pumped things in the medical journals, and then they were able to lobby the government, who they were on the payroll to create new disease categories. So they created the disease category of menopause. Literally, that was a thing, and they created drugs for that. They created the disease category of anxiety and created drugs for that. So they started chipping away into siloing diseases and creating drugs for that, and had huge impact over the medical system, taking the trust engendered post-World War II on acute solves and asking to extend that trust to chronic. In 1960, almost 0% of the U.S. healthcare budget was on chronic conditions. Today, it's over 90%. So we shifted everything to chronic. We had miracles before World War II in medicine, emergency surgical procedures, as I said, things to cure things that were going to kill you right away. The post-World War II chronic disease empire has grown the healthcare industry substantially, but been an abject failure. And that is the point that I'm like basically devoting my life to. We have to wind that back. My sister graduating Stanford Med School and having to choose between 1 and 42 specialties under a system that was created by John D. Rockefeller in a corrupt way in 1909, that law has not been changed to this day. The Flexner Report literally is the standard by law of American medicine today. That is wrong. The body is not 42 individual parts. My sister was a head and neck surgeon and just had to pass out below her table again and again and again where she cut out their sinus infections. She did not ask or was not trained to ask whether that sinus infection that she kept having to cut out for the same patients again and again was potentially that inflammation that led to that infection was related to the fact that every single patient she had under her knife had diabetes, heart disease, kidney disease, and many other comorbidities. There's no connections. That was built by design because a patient that sees an endocrinologist for their diabetes, that sees their cardiologist for their heart, that sees their psychiatric person for their SSRIs, which they inevitably are on if they have all these comorbidities, that sees their head and neck surgery for their surgeon for their inflammation on their sinuses. That's a profitable patient. That's what Rockefeller designed. So when I talk to lawmakers, the problem with healthcare is not page 205 of the Medicare Part D law of changing this policy slightly. The problem is that the incentives of the system itself are propagated for us to be sick and to silo diseases into these fake categories. It is a fake thing to say to a patient with diabetes and cardiovascular issues and high blood pressure that they have 3 different issues. That is just medically actually a negligent thing to tell. It's the same thing. But every doctor that graduates from Harvard Med School, Stanford Med School, and every top med school in the country does not understand that. So anyway, that's how I see how we built this system. I think it's very, very clear and very deliberate structure that's been set up that few people understand and we need to understand.
Oh, that was interesting. Really important. And as you share that, the depth of how far back all this goes and the amount of money, the amount of corruption involved, it gets me thinking about coming back to earlier we talked about solutions, and I want to end with that. If we get to a place where people by default are understanding what you're talking about today with chronic disease, and we are getting to the root of it, and we change the way medicine works and the whole ripple out effect that'll happen, is there a way to do that without totally collapsing our whole system? And there might not be anything wrong with that. I haven't thought out the implications of all that, but is there a way, because there is so much money now and so many different players, can we get out of this without total collapse?
Well, collapse of what?
Well, just when you hear the different involvement of big food, big pharma, universities, scientific journals, and the whole medical system, there's so many players and so much money. If all of a sudden, again, I want to get to this, talk about some of the ways we can correct metabolic health, which are pretty simple. So if we continue, people like me, to push this message and make it simple for people, and they start to fix their metabolic health and don't rely on medicine, there's going to be a huge ripple out effect in the whole economy and the way everything is currently flowing, because there is so much money and so many people involved that are relying on one another. So like, if that happens and we figure our way out of this and we're using medicine for what it's good at, which is acute care, how does that keep the system from totally can we keep the system from not collapsing?
Yeah, well, I think it's the biggest issue we face in the country. I think if you look 50 years in the future, and if you assume the American experiment ends, I don't think it's going to be because we had the wrong level of marginal military spending. It's not going to be because of kind of the latest controversy, frankly, even social justice issue written about in the papers. It's not going to be because of all the other trivia that's being discussed on cable news or in Congress, quite frankly. The number one reason for the American experiment failing will be because we let our population get sicker, fatter, more depressed, more infertile. Infertility is a huge issue, by the way. It's sperm count's down 50%, PCOS is skyrocketing. Our bodies are losing the ability to reproduce at a pretty alarming rate. It's going to be because we let that happen while bankrupting our country with healthcare costs. And, just to answer your question, but let's just set the table here. I think we talk about healthcare costs so much that our eyes gloss over, but 20% of GDP, growing at double the rate of GDP, producing worse outcomes for American human capital, American health, for each dollar that we contribute more to it. It's going to be 40% of GDP in 15 years, right? So it truly is, it is on an unsustainable trajectory. It's getting worse. And by definition, it's unsustainable and will have to change because it will bankrupt the country. That's not that's just the math. So if you agree it's unsustainable, it has to change at some point. And the only way to change it, I think, is a dismantling of the system, because we're not going to drug our way out of this problem. We're not going to trying to over-engineer and hack our human biology and our fertility and our metabolic health, which is millions of years in the making and we have no compensation of whatsoever, has brought us to this point and is not going to get us out of it. So if you agree with those premises, it's not marginal tinkering to the system. It's changing the fundamental incentives of the system. But that system is the number one employer in the country and the number one money generator in the country. So when you go to any city in America and look at people's houses, their dignity and their lives, it's a lot of those people, it's funded by this broken system, to be just direct. So it is a very scary thing, actually. Unwinding this system to the degree that I think actually mathematically has to be done eventually, I don't see how it doesn't cause a lot of short-term economic carnage, to be frank. I think it's necessary for our long-term competitiveness because I think it actually is alarming what's happening to our physical and mental health. And again, we're losing the ability to reproduce, which I couldn't imagine a bigger alarm signal from our biology than that. It's our core evolutionary function from being on the earth. So that's what I'd say. I am optimistic because your listeners, millions of people, are waking up and I think realizing, that we need to change and there is a bottoms-up revolution. I am pessimistic because I don't see a way that this doesn't cause mass economic dislocation in the short to medium term.
Yeah, no, that's exactly what I'm getting at. The fact that for good and bad, the solution to this is cheap and simple. If people start moving their bodies and start eating whole foods, they're going to be well on their way to getting to what we're talking about, fixing their metabolic health. So that's not going to create a lot of jobs, and that's not going to stimulate the economy. And a lot of everything, like you said, that you gave the example there when people go back to their house, a lot of this is built on this system we're talking about. So I don't see a way out without a lot of pain along the way because we're so far down the line, and the solution doesn't involve a lot of spending and a lot of complexity.
Yeah, well, I would just say that I think it is the solve for our long-term economic growth and competitiveness, because the economy is nothing other than the inputs are humans. And right now, systematically, Americans are not at their best. When you look at the 80% of American adults being overweight or obese, obesity isn't the problem per se. Obesity is a visible sign that the person's cells are malfunctioning. 20% of our energy is produced in our head, right? The relation between metabolic dysfunction, diabetes, obesity, and depression is very clear, right? Diabetes, obesity, those are signs of metabolic dysfunction. But when you have metabolic dysfunction, it means, again, 20% of your energy, your metabolism is in your brain. It literally most likely means your brain is not being powered correctly. And there's increasing science coming out that mental health disorders are very, very metabolically tied, and tied relatedly to our gut and our microbiome, which is heavily influenced by our food. So I think actually we're going to decline economically if we don't understand that we're systematically, like, basically committing suicide against the inputs of the economy, which is humans and the brains of humans. Like I actually think getting health better and health right, and understanding that we can't have a population that we're poisoning and expect to have long-term economic competitiveness. Understanding that's important. It's going to cause short-term issues, but I think it's the long-term thing that's, it's just simple. We have to stop poisoning our population to probably achieve ultimate American competitiveness, in my opinion.
And another way of looking at it is the success and the general health of society, not metabolically, but, from the American perspective, from the world's perspective, what's going on in North America is a success with the way things are running and the success of the nation. What I'm getting at, the other way of looking at that is at a cost. It's actually not real. When you see the economy, and I'm no expert in this, but when you see, the US being this world power and having all this power and prestige and success, maybe that just isn't real. And maybe that is just, for the last, who knows, 100 years has just been built on a house of cards. And that, when this falls apart, it's just going to reveal what's been there. And this money and the success really isn't anything tangible.
100%. I think that's I think we've lost our way by not understanding that the foundation of public policy should be the health and happiness of individual citizens. That if that's prioritized first, then good outputs will come for society and from that. But yeah, I think it does get to a spiritual thing where some of the largest industries in the country profit off people being addicted and sick. Those interests have been really able to, let's not be conspiratorial, just be factual. Again, they are the largest funders to government. They are the largest funders to news. They are the largest funders to medical organizations. They're the largest funders to civil rights groups. They're the largest funders to almost every institution that we trust. And again, their core economic imperative is for us to be addicted and sick and in fear and not trusting our own bodies, but trusting them. So unwinding that, I just cannot imagine a more pressing public policy need. And the public policy, from the top down, getting to solutions a little bit is, to me, very simple. We need to stop recommending poison, and we need to stop subsidizing poison. We recommend the wrong things from our government agencies, and we subsidize ultra-processed food, sugar, hundreds of billions of dollars per year, and obviously subsidize pharmaceutical interventions, which are neutral to negative, I'd say, on most indicators, in my opinion, and we don't incentivize actual medicine, true medicine, which is exercise, food, sleep, sunlight, chronic stress management, true things that relieve the underlying cause of most disease. We don't subsidize that. So we need to subsidize the right things, and we need to stop recommending poison.
Yeah, I really want to get into the subsidizing. That's another whole piece of this dirty money and a core part of the problem here. Talk about what the government's doing with money and propping up these, certain crops that are leading to processed foods, and how this is all convoluted as well.
Yeah, tracing the history, after World War II, we had the Marshall Plan. We were trying to feed Europe. There was a big push for shelf stability. Stable food prices was a political issue. And we had a huge push to shelf-stable, ultra-processed food. Maybe started with good intentions, but that was co-opted by the food industry, and now up to 70% of our diet's ultra-processed food. where if you look at any label of anything in a package, it's highly processed grains, which is a new invention where they take the fiber off, which is a lot of the nutrition, and blunts the glucose impact. It basically turns the glucose in the blood, sugar, and then seed oils. Also created by John D. Rockefeller as a byproduct from oil production, used for a long period of time in the early 1900s as oil lubricant. But the Rockefeller family realized they could convince regulators to approve it for human consumption. And now it's the top source of American calories is oil lubricant, seed oils. So those are the components of ultra-processed food, which, again, maybe with good intentions, but the food industry has basically co-opted these post-World War II necessity for shelf-stable food to make it the predominant, because shelf-stable food, ultra-processed food is much more profitable. It's much more profitable that something doesn't spoil, things like that. So, okay. So what that's led to with the growth and the power of the food industry is lobbying to have massive amounts of subsidies for U.S. agriculture. 90% of subsidies in America go to the components of ultra-processed food, corn, soy, wheat, and you can't make this up, but cigarettes, tobacco, get more federal subsidies than vegetables. Vegetables get 0.4% of all of the crop subsidies.
How?
Because vegetables are considered a specialty crop. There's no brand names for vegetables that we could think of. Vegetables are less profitable than branding something and putting it in a box, labeling it Cheese Whiz or labeling it Doritos. So the big food companies are able to steer funding towards ingredients that produce highly processed food, which is processed grains, seed oils, and sugar.
But talk more about the tobacco piece, how that fits in.
I mean, tobacco, in the 1950s, I think it was 1950s, was 7% of U.S. tax revenue, which, I think that was a huge financial reason we didn't speak out about tobacco for a long time. Just historically, it's an important, it's a politically powerful and kind of culturally important part of a lot of states. And as we've unwound tobacco a little bit, which I think in a way is a helpful message for like what's happening with ultra processed food, I think we'll follow eventually the similar tobacco playbook of winding down our ultra processed food addiction, hopefully, because the evidence is so unimpeachable. But it's been a wind down. I mean, there used to be massive amounts of crop subsidies for tobacco. That's wound down, but there still exist subsidies as we've wound down and transitioned tobacco farms, and the subsidies for tobacco, which still has powerful lobbying forces, is more than vegetable farmers. There's not a big lobbyist for big broccoli. There's not a big lobbyist for diabetic kids who need natural whole food diets that don't have glyphosate sprayed all over it. So the pepper lobby, the broccoli lobby has lost out to the tobacco and the ultra-processed food lobby.
Another piece of this puzzle I want to make sure we address is the food stamps, or now SNAP, and how this ties into processed foods and people with lower income having access to good quality food.
Yeah, so there's direct subsidies, but there's two other big windows that I look at of what distorts the food market. So SNAP, formerly food stamps, 15% of the American people depend on for their nutrition. It's the Supplemental Nutrition Assistance Program. We're the only country that lets that go to diabetes water, Coke, sugary drinks, and ultra-processed food. So the number one item purchased on SNAP is soda and sugary drinks. 10% of all food stamp dollars go to diabetes water, sugar water. 70% of food stamps SNAP go to ultra processed food. So that's heavy lobbying. I helped Coke lobby for that. This is a story I've shared a lot of helping Coke pay the NAACP to actually label people who were saying Coke shouldn't be included on SNAP. The NAACP, who was paid millions of dollars by Coke, said that those people were racist because they were snatching the Coke away from lower income children, which is a perversion of the situation, because I actually think what's racist is food companies lobbying government programs to shove very addictive and harmful products into the hands of kids whose moms are depending on those programs to have some semblance of nutrition. So, we subsidize $10 trillion a year from the U.S. Treasury to soda companies with our SNAP program. The second one is one of the largest sources of nutrition for kids, food for kids, is federally subsidized school lunches. Through a ton of lobbying, there is zero nutrition standards for the federally funded school lunch program. So the U.S. government is spending billions on that to feed kids poison, and that program, of course, has used things like the Food Compass and other rigged studies to feed those kids, to say pizza is a vegetable, to say now Lunchables, because they have one apple in them now. It now counts as fruit and counts for reimbursement. So that's another big area. Michelle Obama obviously talked about that a little bit as she started the school lunches. She was immediately pressured by big food companies. John Kerry's family, who started Kraft Heinz, personally lobbied her. She dropped the talk about school lunches and moved to exercise, and ended up partnering with processed food companies and Kraft and others to put exercise as the reason kids are obese, which is important, but not the first issue, obviously. She was actually right to start with the school lunches. Actually, it is I believe a massive, as we talked about, financial issue and a national security issue, because kids are not even able to join the military. So I think it should next time be the president, the Secretary of the Treasury, and the Secretary of Defense demanding that we get our school lunches under control. In France, every daycare in the country is overseen, their diet is overseen by the government. It's natural food, no glyphosate, 4-course meal in every daycare in France, including a cheese course, and is one of the highest public policy priorities in the country to make sure that kids are getting natural, fresh food. And I think that's right.
That's incredible.
Yeah.
Let's talk about
cheese course.
your involvement with all of this, because you're now one of the biggest voices pushing against, but you've come from the other side of the table. So talk about your involvement pushing for and the pivot you made to what you're doing now.
Yeah, so my story is I grew born and raised, I'd say, in the swamp. I was actually born in DC and raised there in the district. And really had dreams of working in politics. And what I learned after graduating college and working on some campaigns is that after the campaigns are over, people from both sides of the aisle inevitably are working for food and pharma companies. So you go in consulting after doing the campaigns, and that's what everyone is like, now working together to help these big industries who pay the most money. So it was interesting. I didn't put all the pieces together, but helped Coke, make sure that food stamps are funding Coke, helped pharma make sure opioids continued to be prescribed. And had some problems with that. Didn't connect all the dots, but left that industry. Went to Harvard Business School and to become an entrepreneur, started some companies. So been an entrepreneur for the last 10 years. And where the pieces started connecting is my sister, Dr. Calley Means, as I said, one of my best friends, pride of the family, Stanford Med School, surgical residency, abruptly quitting after realizing that she was doing her third sinusitis surgery of the day and had no idea why the patient below her knife had inflammation, and actually was almost by design not taught why patients are getting sick, just taught how to cut open the basically food-based inflammation right in front of her and not ask questions. as we talked about, she quit and went on, is a great advocate for metabolic health. And then in 2021, as my previous company was being sold, which was in e-commerce, it really came together for me. So in early 2021, my mom was taking a hike and had a pain in her stomach, went to get a scan, and then realized she had stage 4 pancreatic cancer, died 12 days later. And at Stanford Hospital, as she was dying, the oncologists, the top oncologists in the world, were saying it was unlucky. But learning from Casey, it wasn't unlucky. My mom was on 6 medications. She was the normal American 70-year-old. She had high blood sugar, was on the metformin, was on the statin for high cholesterol. But, close to 50% of people her age are on the statin, right? This was normal. This was like, you're fine. She was told in her checkup 2 months before that she was healthy. She was on less medications than the average person her age. Her doctors were high-fiving her for being healthy. But her high blood sugar, her high cholesterol, her high blood pressure, her struggles with obesity, these were all warning signs of metabolic dysfunction that were never raised for her, that eventually presented itself in something life-threatening like cancer. That's happening to millions of people. Life expectancy now is going down for the most sustained period in American history since 1860. We are actually facing a crisis right now of life expectancy due to deadly diseases that for every person with those deadly chronic diseases, there's been decades of warning signs that are not called out by the medical system. So that helped me put the pieces together to my early experience working for these firms, inspired by my sister. So decided to devote my life to this issue. So working with my sister on a book, which will release next year, called Good Energy, available for pre-order this week, actually. These insights helped me start a company called TrueMed. And TrueMed, as I said, helps. TrueMed follows the science. We do medical intake. I'll say this one more time. At TrueMed, we follow the science and have a medical intake where people list the conditions that they are trying to reverse or trying to prevent. And for almost any condition folks list, obesity, depression, diabetes, etc., the best, most scientifically proven way to reverse or prevent that condition is usually a mix of a sleep, food, supplement, exercise intervention. And we simply just write that in a note. We simply just put that plan in a note that clearly the exercise shows, it's clearly the research shows that if you exercise 150 minutes a week, it's the best possible thing you can do to lower depression. And we just put that research in a note. And then with that note, people can buy exercise tax-free. They can use their HSA, FSA funds. So at Stanford Med School, my sister didn't learn how to write a letter of medical necessity for exercise, but it's perfectly appropriate. It's clearly delineated by the IRS that a doctor can recommend specific interventions. It doesn't have to be a pill. And that unlocks FSA, HSA spending. So we're making that super seamless, partnering with leading health and wellness brands to get people the medical notes that follow the science, and importantly, help them save money on healthy activities that aren't incentivized right now. So that's what the company does. And yeah, I, kind of connected with that, have been able to speak about my experience, which has been rewarding. And I'm just hoping my main goal with all of this, talking about these stories of seeing inside this corrupt system, is just everyone should have confidence to ask their own questions. Their systems, we all kind of know this high level, but these systems really are aligned against you. And it is okay to ask questions about preventing chronic conditions for you or your kids. You can question your pediatrician. It's okay.
Calley, as somebody who is so vocal in the public, sharing this message, and there is so much corruption and money, and big companies obviously don't want this info to get out and disrupt all the things they're doing. My question for you is, has there been any, and I'm assuming there must be, resistance and companies pushing back, threats as you're sharing this?
Yeah, I expected more. I have not received many direct threats. I think that is smart on their part because I'm not doing anything wrong. And if they did, I would just use it to create more of a fuss. So I think it's actually how I would advise them to respond, which has been surprising. But this gives my life meaning. I think these are powerful industries. I think they are committing violence to the American people, to be quite frank. But it gives me meaning to speak out. I mean, it sounds trite, but I mentioned my mom kind of dying, I think, at the hands of a broken system. I have a new, young son who I think is walking into a wood chipper. Kids in this world, particularly this country. So it gives me a lot of meaning to speak out on this, and haven't been too worried about it. But I think this is what we need to do. I see myself as one of thousands of people trying to chip away, and I think there's great value, to what you're doing. Communicating to listeners and having people on that have had massive impacts on my life. Preaching the gospel of root cause health and metabolic health, and I think if we keep chipping away, we're going to be okay.
I hope so. I think so. You've mentioned your son a couple times, and you mentioned before how at his daycare you need to provide all your own food because of the terrible options that they have there. What are some of the other things as a relatively new dad you've had to do to navigate this world that you've described?
I just think it's doing your own research and having awe for the journey kids are on. I mean, kids are born perfect. I think they have a predisposition to natural food. They have a predisposition to awe and wonder for the world. They like to sleep. They like to move. They're curious. And I think we systematically, with our institutions, from profit motives, beat that out of them. I mean, I mentioned John D. Rockefeller a lot, but I think he was one of the most dangerous people of the 20th century in world history. He also funded and helped create the structure for a lot of early childhood education. And his quote is that I want a nation of workers, not a nation of thinkers. We push kids who are on the fastest learning curves of their entire lives, learning how to talk, learning how to make sense of the world, learning how to walk, with not a lot of top-down training, but just curiosity and wonder for the world and exploration. We basically take that data of literally the fastest learning curve of their life and then sit them at a desk and lecture them. We feed processed food, shove it down their throats, and sugar water. We subject them inevitably to a lot of our psychoses as adults and chronic stress. So my thought is just how can we prevent as much as possible transporting the psychoses of our society onto that kid and actually learn from them. How do we foster their and perpetuate their sense of awe for the world? How do we, on food, not give them poison? I mean, the parents have complete control over a kid's diet, for at least the first 2 years. It's just a simple principle, and it's not judgmental to anybody, but it's like I think we just shouldn't give kids poison. We should not give them sugar, particularly added sugar. Should not, I believe, give them highly processed grains or seed oils. I think that should be the standard for kids, that we shouldn't be eating frankenfoods that, and ingredients that were created in just the last 100 years that were not biologically made to eat. So it's just from first principles. I am blown away. I mean, I'm just blown away by how we need to keep what kids are born with instead of push our own crap on them. It's kind of where I come from.
Throughout our conversation, we've touched a little bit on the dietary piece and some of the lifestyle changes people can make who are in a position right now with compromised metabolic health, or somebody that just wants to maintain if they're lucky enough to be in a position where they have that right now. But let's give people who've tuned into this point a brief overview. And we've said it's cheap and it's simple, but what can people do after this conversation, starting today, to start to regain their metabolic health?
Yeah, so I think from my perspective, there's been trillions of dollars of incentives to convince you that it's complicated. I think that there's also a huge incentive for health influencers who have impacted me a lot, and I have amazing admiration for, to have their own niche and have tips and have their own products and overcomplicate the issue too. To me, we can have a radical renewal of health in this country if we follow very simple health principles. Throw out all nutrition research and just don't eat added sugar, don't eat seed oils, don't eat highly processed grains. If you cut those 3 ingredients from your diet, no matter what dietary philosophy you are on, you are almost certainly steered towards more natural food. And if you are eating processed food, it's probably a little bit less inflammatory and poisonous. So that's my principle. I think there's a lot of other rabbit holes, obviously, you can go down, but I think that should be I think if you threw out all 50,000 nutrition studies produced in the last 2 years and just had those 3 principles, we would transform society. So those are the big principles I personally have, is that if I am winning, if I can reduce or eliminate those 3 ingredients, move 150 minutes a week. I think there's a lot of controversy around what exercise. Do we do zone 2? Do we do HIIT? Do we do this? There's not an epidemic of people that are moving consistently that are not doing it the right way. And I think, again, fitness influencers have their own philosophies, but that's my principle for me now. It's my principle, like, hopefully for the family and our young son. It's like, if you could just have a daily habit of moving and hitting that 150-minute minimum goal, that led me to more, okay, how do I optimize that? Researching. But it just 150 minutes. I mean, that's how, and I'm not great at this. I'm on my own journey, I've had ups and downs. But it's like, that's the heuristic I have in my head, 150 minutes. And then it's basic. I mean, I'm on a journey on sleep. I'm on a journey realizing how important sunlight is. And I think light is actually becoming an important factor. There's a lot of research that I buy because this idea of natural or unnatural light is really just a phenomenon in the past 150 years. You just got to ask, what is messing with our evolutionary biology? Light is a big one, I think. So I'm going deep into that. And then I think chronic stress management. I think we have weapons of mass destruction to hijack our cortisol and stress levels in our pockets. And there's massive profit in us being in fear and having our cortisol levels increased by a lot of different entities and being aware of that. I guess the last one I'll just say is just circadian rhythms. It's kind of related to light. Just a concept I've been thinking about is, until 200 years ago, but really in the past 100 years, almost every human ever born ever didn't travel within 30 miles from where they were born. The sun went down, there was no light for them. They went to bed. And I'm starting to go down that rabbit hole. Again, what has changed? So much has changed so abruptly, so quickly. That's something I'm honestly on a journey on, but just like the circadian rhythms, I think is an important area that a lot of folks are talking more about that I think falls into this.
All right, and we'll end on this, and we did touch on it before, but to get into a bit more detail, solutions when it comes to the system. And I want to break this in 2 different pieces. For people that, have tuned into this point and they've heard about all the corruption going on in the system of food and medicine and all the offshoots of that, what can they do on a personal level for them and their family to protect against that? And then as a grassroots movement with society as a whole to push back and to be part of the change, what can they do?
Yeah. So more from the bottoms up, what I would say the family can do on food as medicine is the number one principle I have is have the courage to push back on your doctor or pediatrician. And I'm not reflexively just 100% anti-drug, but if they're putting your kid on some kind of medication, when they're giving your child nutritional advice, when they're putting your teenager on an SSRI or Ozempic, when they're trying to give you a statin or push you on a fertility protocol that's medical first. These are warning signs. These are warning signs that will be less likely to be solved if you get on the chronic disease pharmaceutical treadmill, and will be more likely to be solved if you use that as an opportunity of something to have gratitude for, to actually investigate what the root cause is. And I think that's the key point, is when you or your child is starting to get on that chronic disease treadmill. If your child has an infection or has some life-threatening issue, absolutely see your doctor. But if it's a chronic disease treadmill thing, really be careful about that. Now, this is very cliche to say, call your member of Congress, get involved in politics. But this is what has to happen. We need to unify our voices. The problem is that when the SNAP bill comes up, Coke is organized. They're pounding on the door on that specific issue of keeping the funding for Coke. Now, if you poll the American people, they'd be outraged. 90% would be outraged by the fact that we're subsidizing diabetes water with a government program, but we're not organized. So it is channeling that's how we will win. We have to channel our voices into specific issues. I think it absolutely will help to voice to your member of Congress when you, and just however you can, that we have to have an agenda to get our kids healthier. But it's around specific issues. If you can channel other folks that are frustrated to exert communications or money towards specific issues, that is impactful. Specific issues on my radar are the agriculture bill is up for debate right now, where they're going to renew the funding for soda and food stamps and agricultural subsidies. The USDA guidelines are up for debate right now. There's a ton of just very easy executive orders. We're the only country that allows advertising for pharma on TV. As I said, they're the largest funders of news. There could be unified voice to stop that. The president could sign something to stop that tomorrow, to cut the influence pharma has on news. There are a host of issues like that, but it is channeling your anger into specific issues is how I think we need to start making change.
All right, Calley, that's a great place to end it. Really appreciate you coming on, sharing this knowledge. We're going to link up your website, your social media, everything in the show notes. I'm excited about the book you have up and coming with your sister. Excited to dig into that. And I'm just here to support you any way I can. And I want to thank you again.
Thank you, Jesse.
Now that you're done with Calley, you're going to want to stick around here and catch my chat with Calley's sister, Dr. Calley Means. She'll teach you how to fix your metabolic health. You don't want to miss this. I'll see you over there.
If you are an American born today, you are on a direct trajectory towards having a blood sugar.